So, welcome to today's episode of Hospice Education Podcasts, where today we're actually going to be exploring a topic that's really close to our hearts within hospice education, and that's dementia awareness. I'm joined by our team leader, Catherine O'Brien, who has a wealth of knowledge in dementia. Welcome, Cathy.
Nice to be here, Tracy.
So, Cathy, we know that dementia is something that many people have actually heard of, but do they actually fully understand what it means?
Not necessarily, actually. People make certain assumptions about dementia and
Yeah.
what it means, and there's a lot of fear. And that fear comes from not understanding what's happening or how best to support the person.
Okay.
Understanding what dementia actually is and isn't can make a huge difference.
Well, that's a great place to start there, really. So, how do you explain dementia to someone who's unsure?
The most simple explanation is that it is a disease of the brain, and that disease damages the brain cells.
Right.
People often think it affects memory, that's one thing they do understand, but it affects all aspects of daily life. Alzheimer's is the most common form of dementia, but there are many, many others.
Okay.
And three other common types that people may have heard of are vascular dementia,
Yeah.
frontal temporal lobe, sometimes known as FTD, and dementia with Lewy bodies. I think what's really important for people to understand is that it is not a natural part of aging. It doesn't follow that the older we get, we will get it. Dementia is an umbrella term that describes these different diseases.
Right. So I think that's something that people really do misunderstand. They think it's inevitable.
That's right. And actually, it's not. Age increases risk. We are an aging population, and the longer we live, the greater the risk becomes. In truth, though, as it does with a number of other physical health conditions.
Yeah.
So dementia is not guaranteed as we get older.
Right. Okay. So when someone starts showing signs, what should we actually be looking out for?
Well, obviously, the most commonly understood one is memory loss that can disrupt daily life. But you've got confusion. A person may be disorientated in time, place, or person, or they may find it increasingly difficult to carry out familiar tasks that we all do without having to think about it.
Yeah.
It may be that they experience changes in mood. Problems with word finding is also common. Memory loss is not always the first symptom because
Right.
depending on the part of the brain that is affected, it might be that there are other changes to the way the person thinks and behaves that become more apparent in the first instance.
Sure.
And actually, families often notice this pattern first.
Right. Okay. So once a family realizes that something's actually going on, what can they do to support the person?
There are lots of practical approaches, which I'll talk about in a minute. But I think the first and most important thing is that you talk to the person, you let them know your concerns,
Yeah.
and you encourage them to seek help from the doctor. An early diagnosis can be so beneficial in terms of accessing the right help and support.
Right. And that actually really sounds so much more respectful than actually just taking over everything.
Absolutely. I think some practical approaches are keeping communication simple and calm, offering choice instead of open-ended questions. So keep those choices simple. Instead of what would you like to do today, it might be, shall we go to the shops? Shall we go for a walk? So
Right.
keep those simple and use visual cues such as labels or calendars. There are a wealth of resources out there that can actually make it easier for people living with dementia to maintain their sense of where they are and their sense of time, place, and person.
Yeah.
Keeping routines consistent, Tracy, is also really important. Sudden changes to a person's routine when they're living with dementia can be incredibly unsettling and make a person feel quite vulnerable.
I think what you're saying there, it's about sort of meeting the person in their reality. But what does that actually mean?
Well, actually, it's one of the most compassionate approaches we have. As a person's dementia progresses, their sense of who they are and where they are can shift quite dramatically.
Yeah.
It might be, often it's the short-term memory that's affected first,
Mm.
but the long-term memory remains intact for longer. So a person might actually believe that they are living in a different decade, or they might actually think that a person that they know and love is still alive when perhaps they've died.
Yeah.
It's not unusual as dementia progresses for a person to look at a close relative, perhaps an adult son or daughter, and see their parent
Yeah.
if there's a
Yeah.
familial likeness.
Yeah.
If we then correct a person, we can actually cause distress. So it's important, rather than correcting them or even reinforcing what they're saying, but to respond to the emotion behind it.
Right. Are you able to give us an example of that, please, Kathy?
Absolutely. So something that is often quite common, particularly in advanced dementia, is to have a person say, I want to go home.
Yeah.
Um, and if they say, I want to go home, that doesn't always mean the physical house. It doesn't mean saying to them, you are home. It doesn't mean the last address they lived at.
Sure.
It actually can mean a place of familiarity, safety, comfort, a time in life that they felt secure and happy. So if you respond by saying you are at home, or no, you can't go home, you live here now, it just adds to their disorientation and might increase their distress.
Mm. Mm.
Whereas if you focus on, tell me a little bit about home, what does home look like for you? It sounds like you're wanting to be more comfortable at the moment. It's actually trying to deal with the emotion, pick up on their tone of voice, their body language. What
Mm.
is it that you think they're looking for in that moment?
Mm, that actually seems a much more gentle approach. It sounds to me that you're making more of a connection there with that person, and there's no conflict.
Absolutely. Even well-intentioned correction can feel like a confrontation to a person living with dementia.
Mm,
And if they're feeling a sense of fear or anxiety or loss, you correcting them just exacerbates that emotion.
yeah.
Meeting them where they are helps them to feel safe and understood.
And I think, it sounds like that if you're constantly correcting someone, it almost feels like you're telling them that they're wrong all the time.
Absolutely. And that can not only damage a person's confidence, but it can actually lead to confrontation. It can escalate that sense of anxiety and fight and flight, whereas gently redirecting them can help to maintain that trust in your relationship. But more importantly, it's about preserving dignity.
Yeah.
If somebody believes that they're 30 years old and that they've got to go to work or they've got to pick the children up from school, you dragging them back to the present actually won't help. But enjoy them in the moment. If they say, I've got to pick the children up from school, get them to talk about their children.
Mm,
Where is school? What did school look like? Draw on some of your own knowledge and experience of that decade to actually engage them in the
yeah.
conversation.
Right. You mentioned fight and flight there. And something else that I've noticed is that sometimes people interpret real strong emotions as aggression. Is that something that you see often? Is that common?
Very common. We often notice that people will be labelled as aggressive, but actually, what looks like aggression to us in a snapshot is often an expression of an emotion, and that emotion could be fear, pain, confusion, or
Yeah.
sensory overload. Imagine not recognizing where you are or understanding what somebody is asking you to do. I think that's really scary. If we put ourselves in that situation and what is being asked of us makes no sense, and this strange person is trying to get us to do something,
Mm.
think about how you would respond. The person might shout, push something away, or they might look angry, but actually, it may be fear or distress and not hostility that they're feeling.
Right. So really, what we're saying is that behavior is actually communication here.
Absolutely. If the person is saying something doesn't feel right, they're saying it through their behavior if they can't find the words.
Right.
A more supportive response, rather than thinking, oh, the person is being aggressive and using that term, a more supportive response might be to think about your own interaction and behaviour, lowering your voice, maintaining eye contact, but giving them enough space that they feel they're not threatened.
Yeah.
Simplify the environment. If an environment is busy, noisy, too well lit, that can actually overwhelm the senses. So, trying to calm the physical environment as well as checking your own body language and tone of voice,
Yeah.
and using simple terms of reassurance such as, you're safe, I'm here.
Wow. Yeah. I mean, that really changes how you see the situation. It's actually not about the person being difficult at all, is it?
Exactly. It's about trying to understand the need behind the behaviour that they're expressing.
Yeah.
When we respond to the emotion rather than the action, you usually find that things will calm down much more quickly. One observation I'd make is that when you try, if somebody's in that fight or flight and they want to leave, which isn't uncommon, a person has the need to escape. People use the term wandering in
Mm.
dementia care, but actually, I prefer the term walking with purpose, because in their minds, they have to be somewhere or they have to get to a safe place. And if we actually take the time to understand that, rather than say, no, you can't go out, no, you can't do that,
Mm.
the situation will calm down much more quickly.
I think this must be really hard for families to deal with and handle.
It is. Caregivers often feel very stressed and very isolated. Caregivers often feel that post diagnosis there is very little support for them unless they seek it out themselves.
Right.
And whilst there are support groups and there is respite care and encouraging carers to share that responsibility, all of those can help.
Mm.
But the most important thing, I think, is having someone to talk to who understands. That can make a world of
Yeah, I
difference.
bet. And is there anything people can do to reduce their own risk?
There is. It, there is absolutely. Just as with other aspects of our health, there are things that we can do. Healthy lifestyle habits help. Staying active, eating well, staying socially connected, managing your blood pressure, keeping your brain engaged,
Mm.
making sure your hearing and sight are checked. Hearing loss is quite a significant risk factor, because if a person can't hear, they become isolated and they can't engage. And if you are struggling to focus on what somebody's saying, you're not using your brain to engage and be active as you can. Similarly, keeping yourself physically fit to lower your blood pressure, thinking about not smoking, not drinking too much. So, all of the things that we talk about, in a sense, for things like heart health, apply for brain health as well.
Wow. And if someone is really worried about themselves or a loved one, what would be the best approach for them?
The best step, the first best step, is to speak to a healthcare professional.
Okay.
They can offer general information, talk through concerns, and guide somebody to assessment and support. The GP is obviously a good first point of contact, but there are also helplines through Dementia UK, Alzheimer's Society. So if you feel you've gone for help and you've not been understood, there are alternative sources of help out there that you can access.
Um, that's brilliant, Kathy. So before we wrap up, what's the most important thing you would want people to remember about actually just supporting somebody with dementia?
I think it's knowing the person. It's recognizing that the person is still themselves. There's a brilliant piece of work done back in the 90s now by somebody called Tom Kitwood, and
Yeah.
it was called Personhood. And it talks about the importance of not just seeing the dementia, not just seeing the changes in the person, but actually knowing, the more we know about that person, the more we know about what we might be able to get them to engage with, what matters to them, is so important. Approaches matter, patience, empathy, Small adjustments in the way we approach care can preserve dignity and connection. Dementia does change abilities, but it doesn't erase identity.
Wow, that's a real powerful reminder, Kathy, and thank you so much for sharing all of this. It's so obvious that you have a real passion for dementia awareness, and we'd just like to end with saying thank you for sharing that with us.
Thanks, Tracy. I think conversations like this are really important. The more that we can do to raise awareness of dementia, the more we are going to enable people to live well with dementia for longer and in their own community.
Thank you, Kathy, and thank you for joining us for today's episode of our hospice podcasts.